I think there's several things about being in Canada that has helped my career. One of them is a government initiative called the Canadian Foundation for Innovation. And the Canadian Foundation for Innovation has been very supportive of both young and senior investigators to get world-class equipment into the laboratory. So that's really allowed us to get cutting-edge equipment, which has allowed us to then do cutting-edge research. And I think that's been a major advance. I was fortunate to receive an award when I first started and then as a more senior investigator. Often the awards are only for junior investigators or for more senior people, and I think this is a really nice advantage that we have here in Canada. I think in addition, we have quite good granting support, both with NSERC and CIHR, and fairly early on I think they were receptive to the concept of mitochondrial medicine and mitochondrial biology, and that allowed some of us who were working in the field to start getting grants and continue in this area. I think the other thing that I'd like to emphasize is the healthcare system, I think, in Canada is advantageous. Oftentimes there can be some inequities, and in Canada it doesn't matter if you're pulled off the street and you make no money or you're a multi-billionaire, you get the same priority and you come. And although that people may not understand how that's helpful, I think what it allows us to do is to capture all of the population, because I think genetic diseases don't respect financial abilities, and it's across the whole spectrum of the population, and we need to be seeing all of these individuals and provide them equal access to care, which for us I think has allowed us to get a much broader spectrum of the population in our clinic and really understand mitochondrial disease across the whole spectrum. I think Mito Canada has done several things that have been advantageous to my career, and I think more importantly to the health of people in Canada with mitochondrial disease. First of all, it brought people together that I didn't even know were working in mitochondrial disease. So even at the meeting here today, which was organized by Mito Canada, I'm meeting people that I don't even know their name, and yet they're working in the area of mitochondrial disease. So to allow us to network, to talk, to set up collaborations, I think that's an incredibly important aspect. And whenever you collaborate, whenever you talk to somebody, there's always something that you learn that's going to help your research and ultimately, hopefully, help others. The second thing I think with Mito Canada, which helped me when I was first starting out, is that although our granting agencies are quite good, there's still always the need for more money. And very early on, they made it a priority to provide grants through a very rigorous granting process to young individuals. And although not massive amounts of money, many of these were very important to allow us to get the initial data to then go to CIHR and in some cases even NIH or other granting agencies to then get larger grants. And that continues, and it's been very helpful, I think, to young Canadian researchers. Finally, and most importantly, I think it's something that the patients can be part of. Similar to the United Mitochondrial Disease Foundation, early on it embraced not just having doctors come to talk, but having doctors and patients, so that we always keep in mind what's most important, and that is health of our patients and working towards therapies and hopefully eventually a cure for this disorder. Yeah, I mean, it's very similar to what I mentioned about Mito Canada, and really this is an extension of Mito Canada, and it's a logical extension. And really this just formalizes, I think, some of the concepts that I was talking about, bringing together various stakeholders, basic science researchers, clinicians, and in my case, clinician scientists, and also other stakeholders to help with policy. Because if we don't bring this to the forefront, we're not going to get the same amount of funding. Even in places in the United States, for example, they don't even have billing codes for mitochondrial disease. So I think awareness is critically important, and I think this is just going to further advance our overall mission, which is to find therapies and cures for patients.